Assalamu alaikum dear doctors. In this video I am discussing about Bartter syndrome and Pseudo-Bartter syndrome. So Bartter syndrome, this is caused by an inborn autosomal recessive defect in the sodium potassium chloride ion cotransporter in the thick ascending limb of loop of Hanel, leading to sodium chloride and water wasting. Symptoms are polyuria, polydipsia, episodes of dehydration, faltering growth and constipation. There may be maternal polyhydramnios with an affected fetus. The resultant ECF volume, that contraction causes secondary renin secretion and raised aldosterone levels with avoid sodium ion and water reabsorption in the distal tubule and reciprocal potassium ion H plus ion secretion into the urine. Note that the blood pressure is normal. The hypernatremia is a compensatory response to maintain the normal blood pressure in the presence of chronic ECF volume depletions. There is also increase the renal prostaglandin E2 production. The above changes produce the characteristic biochemical disturbance of hypochloremic, hypokalemic alkalosis. Remember, the biochemical changes of Bartter and Pseudo-Bartter, both cases is hypochloremic and hypokalemic alkalosis. Crucial to the diagnosis is the finding of inappropriately high levels of urinary chloride ion and sodium ion, usually more than 20 millimole per liter. Urine calcium is normal or high. Compare Gitelman syndrome. Therapy involves potassium ion supplementation combined with the prostaglandin synthetase inhibitors, usually indomethacin. About Pseudo-Bartter syndrome. The same plasma biochemistry, that is hypochloremic, hypokalemic alkalosis, but appropriately low levels of urine chloride ion and sodium ion less than 10 millimole per liter. And the main causes of Pseudo-Bartter syndrome are cystic fibrosis, sweat loss of sodium chloride and water, congenital chloride diarrhea, that is gastrointestinal loss, laxative abuse, gastrointestinal loss, and cyclical vomiting. Note that all the changes of Bartter syndrome, including the urine electrolyte level, may be produced by loop diuretics, which block the same site in the thick ascending limb of loop of Hanel. Now, there's some question come on AKP exam. First question is that 6 months with 3 days vomiting and dehydrated. Investigation: sodium is 129, potassium 1.8, pH is 7.49, bicarbonate 3.39. What is the diagnosis? So, here the clinical features and the biochemical finding, that is hyponatremic, hypokalemic alkalosis. So, diagnosis is Bartter syndrome. Next question is that child known as cystic fibrosis presented with vomiting, lab shows sodium 108, potassium 2.3, bicarbonate is 37. What is the cause of the lab abnormalities? Here also the biochemical abnormality is that hyponatremic, hypokalemic alkalosis, and there is a cause is cystic fibrosis. That is one of the important cause of Pseudo-Bartter syndrome. So diagnosis Pseudo-Bartter syndrome. This is all about. Please do subscribe and share. MRCPCH with Dr. Emma Chaudhary. Thank you.